Have you ever felt your heart suddenly racing for no reason, or stood up only to feel the room tilt around you? Most people brush it off as stress, aging, or just being tired. But here's the truth. Those little moments could be your heart whispering the earliest warnings of failure, and ignoring them can lead to devastating consequences. Every year in the United States, millions silently develop heart failure without realizing it until it's too late. The most dangerous part. It doesn't always arrive with a dramatic heart attack or a rush to the ER. Instead, it creeps in quietly through signs so subtle, you might mistake them for nothing at all. That's why today, with the guidance of Dr. Johnny, we won't drown you in medical jargon or confusing numbers. We're going to have a clear, honest conversation, one that could change how you listen to your own body. Because your heart has carried you through every single moment of your life, and when it begins to struggle, it rarely shouts. It whispers. And if you learn to hear those whispers early, you can protect yourself long before a crisis ever strikes. So if you've ever dismissed a racing pulse, swollen ankles, or endless fatigue as just part of getting older, stay with me. What you'll hear in the next few minutes may be the most important conversation you've ever had about your health, and it just might save your life. When your heart begins to struggle, it doesn't always scream in pain. Sometimes it simply speeds up like an exhausted worker rushing to finish the job. A fast resting heart rate is often the very first sign that your heart is under pressure. Picture this: you're sitting quietly on the couch, reading the paper, and suddenly you feel a heavy thump racing in your chest. Margaret, a retired teacher from Ohio, used to think those moments were just nerves, or maybe too much coffee. But when it kept happening during calm evenings, she realized it was her body's alarm system. Science backs this up. The American Heart Association warns that a consistently high resting heart rate, regularly above 100 beats per minute, is linked to an earlier onset of heart failure and higher risk of complications. Your heart should normally rest between 60 and 100 beats per minute when you're calm. If it's racing beyond that without reason, it means your heart is working overtime, even when you're not. Over time, this constant strain weakens the heart muscle further. That's why doctors suggest keeping track of your resting pulse. You don't need fancy equipment; a simple wrist monitor or even a smartphone app can do the job. Just by logging your heart rate a few times a day, you can give your doctor valuable clues before the problem grows worse. But only knowing this one sign isn't enough. Because the heart doesn't just show stress through a racing beat, it can also whisper through your memory, your focus, and the way your brain feels every single day. And that's where the next signal becomes even more surprising. Your heart doesn't just reveal stress through your chest, sometimes it whispers through your mind. Many people blame forgetfulness or mental fog on just getting older, but often it's your brain quietly begging for more oxygen. Imagine walking into a room and suddenly forgetting why you went there, or losing track of a simple conversation halfway through. Robert, a 72-year-old carpenter, told his family he was just getting forgetful. But when his lapses grew more frequent, doctors discovered his heart wasn't pumping enough blood to his brain. The science is clear. Research in the Journal of the American College of Cardiology shows that even early heart failure can bring measurable cognitive decline. The brain is a hungry organ consuming nearly 20% of your body's oxygen supply. When the heart weakens, that supply drops, and the result isn't just daydreaming, it's mental fog, misplaced keys, and a feeling that your mind just isn't as sharp as it used to be. The good news: tracking when these moments happen can give powerful clues. Do they come after climbing stairs or late in the evening when you're tired? Writing down patterns can help your doctor connect the dots before the damage deepens. Protecting your memory is not just about brain health, it's about supporting your heart too. But only knowing this isn't enough, because the heart has another way of showing strain that you can actually see with your own eyes. And it often shows up not in your brain, but down in your ankles and legs. If your memory can show the whispers of heart trouble, your legs can sometimes shout it. By the end of the day, have you ever noticed your socks leaving deep grooves around your ankles, or your shoes feeling tighter, even though they fit fine that morning? That swelling isn't just tired feet, it can be your heart struggling to keep up. Sarah, a 65-year-old grandmother, thought her swollen ankles were just from standing too long in the kitchen. But when she finally pressed her thumb into her shin and saw a dent remain, she realized something more serious was happening. Doctors call this peripheral edema, and it's one of the earliest and most visible red flags of heart failure. Here's why: when the heart can't pump effectively, blood backs up in the veins and fluid leaks into the surrounding tissues. The result is puffiness in the feet, ankles, or lower legs that gets worse as the day goes on. According to the National Heart, Lung, and Blood Institute, this kind of swelling is a strong signal that your heart is under strain. A simple at-home test can reveal it. Press your thumb into your shin for a few seconds. If the skin holds a dent, it's time to mention it to your doctor. Don't ignore new or worsening swelling, especially if it's paired with sudden weight gain or shortness of breath. Your legs are often telling the story of what's happening in your chest. But seeing the problem isn't enough sometimes. You actually feel it in a way that can stop you in your tracks. And that's where the next warning sign appears, leaving many people lightheaded, dizzy, and at real risk of falling. If swollen ankles tell the story, you can see dizziness is the warning you can feel. Have you ever stood up from a chair only to watch the room tilt for a few seconds, or felt so lightheaded you had to grab onto something just to steady yourself? Many people laugh it off as getting older, but in truth, it can be one of the earliest signs your heart isn't sending enough blood to your brain. James, a 70-year-old veteran, used to ignore these dizzy spells. He thought it was just dehydration or standing up too fast. But when he nearly fainted while walking across his living room, his doctor explained the real cause: weak circulation from an overworked heart. And science confirms it. The European Heart Journal reports that reduced blood supply to the brain is closely linked to dizziness, near blackouts, and fainting in people with early heart failure. This isn't just uncomfortable, it's dangerous. For older adults, one fall can change life forever. That's why it's important to write down when dizziness happens. Does it strike after rising from a chair after light activity, or only in the evenings? These small details give doctors the clues they need to act early. If you've experienced more than one dizzy spell, don't ignore it. Sit down right away, breathe slowly, and let your body recover. But most importantly, bring it up with your doctor. Protecting your balance means protecting your heart. And as unsettling as dizziness can be, there's another warning sign that interrupts not just your day, but your night, sending you back and forth to the bathroom again and again when you should be resting. As troubling as dizziness can be, some warnings don't hit you while you're awake, they follow you into the night. Do you find yourself waking up 2, 3, even 4 times just to use the bathroom? Many people chalk it up to age or a small bladder, but frequent nighttime urination. What doctors call nocturia can be a clear signal that your heart is under stress. Here's what's really happening. When you lie down, fluid that's been pooling in your legs during the day shifts back into your bloodstream. Your kidneys kick into gear, filtering more, and suddenly you're making repeated trips to the bathroom instead of getting deep, restful sleep. Mary, a retired nurse, thought her nightly wake-ups were just part of getting older. But when her doctor connected the pattern to early heart failure, everything made sense. The Cleveland Clinic highlights nocturia as one of the earliest red flags, often appearing before more dramatic symptoms. And it's not just inconvenient. Broken sleep weakens your immune system, drains your energy, and forces your heart to work even harder. A helpful tip: try elevating your legs for a short time during the day to reduce fluid buildup. But if nighttime bathroom trips remain frequent, bring it up with your doctor. Your nights are supposed to be for rest, not for endless interruptions. And if your body is sending you signals in the quiet hours, it deserves attention. Because the next sign isn't just about sleep. It can leave your hands and feet feeling cold, even when the room is warm. Another hidden way your heart shows it's struggling. If your nights are restless because of constant bathroom trips, your days might bring a chill you can't explain. Have you noticed your hands or feet staying cold, even when the room feels warm? Some people blame poor circulation from aging, but often it's your heart quietly prioritizing survival. When the heart grows weaker, it makes choices sending blood to the brain and vital organs while leaving the skin, arms, and legs with less. Daniel, a 66-year-old grandfather, used to wrap himself in blankets while his family sat comfortably in t-shirts. He thought it was just him getting older, but doctors later revealed it was his heart struggling to push enough blood to his extremities. A study published in the American Journal of Cardiology confirms this reduced peripheral blood flow is a common marker in early heart dysfunction, and cold fingers and toes are often the body's way of showing that the core is being protected at the expense of the edges. If this happens, often pay attention. Compare your hands and feet to those around you. If they're consistently colder, note it down and share it with your doctor. It might seem like a small detail, but it could be the earliest whisper of a larger problem. And while cold hands and feet may be uncomfortable, the next signal is even harder to ignore. It leaves you breathless, not after a long run, but from simple tasks like climbing a few stairs or just walking to the mailbox. If cold hands and feet are easy to dismiss, shortness of breath is much harder to ignore. Do you ever feel winded after climbing just a few stairs or notice yourself gasping for air while walking across the yard? That heavy out-of-breath feeling isn't always about being out of shape. It can be one of the most common early signs of heart failure. Here's why: when the heart can't pump strongly, enough blood begins to back up into the lungs. Oxygen has a harder time moving where it needs to go, and suddenly even light activity feels like running a mile. Evelyn, a 70-year-old gardener, noticed she was pausing more often while tending her roses. She thought it was just age catching up, but her doctor explained that her breathlessness was her body's alarm, not just slowing down. Research published in the Journal of the American Medical Association shows that shortness of breath with mild exertion can appear years before an official diagnosis of heart failure. That means catching it early can truly change outcomes. The best thing you can do is pay attention to patterns. Do you struggle while carrying groceries, talking while walking, climbing a short flight of stairs? Write these details down, they matter. But don't push through heavy fatigue. Pace yourself, rest when needed, and never ignore breathlessness that feels out of proportion. What may seem like a small nuisance could be your heart asking for help. And as troubling as breathlessness during activity can be, the next warning sign sneaks in at night when you lie down and suddenly realize you can't breathe comfortably without an extra pillow under your head. If shortness of breath during the day slows you down, struggling to breathe at night can steal your rest. Have you ever tried lying flat in bed only to feel pressure in your chest forcing you to grab an extra pillow, or even sleep sitting up in a chair? This isn't just snoring or age, it's something doctors call orthopnea, and it's a powerful early warning of heart failure. Here's what's happening. When you lie down, fluid that's been building in your body shifts upward, pressing against your lungs. A healthy heart handles this easily, but a weaker one can't keep up, leaving you gasping for air. John, a 74-year-old veteran, found himself stacking 3 pillows just to make it through the night. He thought it was acid reflux, but in truth, his heart was struggling under the load. Studies in the New England Journal of Medicine show that orthopnea isn't just uncomfortable, it's a strong predictor of heart failure, progression often appearing long before more dramatic symptoms. That's why doctors ask simple but telling questions. How many pillows do you need to sleep? If the answer keeps going up, that's a red flag worth attention. So pay close attention to how you rest. If lying flat leaves you short of breath, don't ignore it. Your body's sending you a clear message. And while nighttime breathlessness disrupts sleep, the next signal can be even more alarming because it shows up suddenly on the scale when your weight jumps in just a day or two without any change in your diet. If needing extra pillows at night feels unsettling, the next warning can be downright shocking. Imagine stepping on the scale one morning and seeing that you've gained 2 or 3 pounds overnight, even though you ate the same as always. That sudden jump isn't from food, it's from fluid, and it's one of the clearest early signs your heart is struggling. Here's what happens. When the heart can't pump effectively, the kidneys hold on to salt and water. This extra fluid builds up inside the body, not only pushing the numbers on the scale upward, but also causing swelling in the belly, ankles, and even making breathing more difficult. Richard, a 69-year-old from Texas, thought his scale was broken when he saw his weight spike 5 pounds in a single week. But doctors quickly explained that his body was holding fluid because of heart weakness. According to the American Heart Association, a gain of more than 2 to 3 pounds in a single day or 5 pounds in a week is a red flag that should never be ignored. That's why many cardiologists recommend weighing yourself at the same time every morning. It's one of the simplest tools to catch hidden fluid retention before it spirals into an emergency. So if your scale shows sudden changes you can't explain, don't brush it off. Keep a log, call your doctor, and take it seriously. Because while rapid weight gain can be measured in pounds, the next warning sign hits in a different place. Your stomach, where bloating, fullness, and a sudden loss of appetite can quietly reveal the same underlying problem. If sudden weight gain can shock you on the scale, the next sign can take away your appetite altogether. Have you ever sat down to a meal only to feel full after just a few bites, or noticed a tight, bloated belly that doesn't match what you've eaten? Many people assume it's indigestion or age slowing down digestion, but in reality, it can be your heart signaling distress. Here's why. When the heart weakens, fluid doesn't just pool in the legs, it can collect in the abdomen too. Doctors call this ascites, and it places pressure on the stomach and liver. That pressure makes you feel stuffed even when you haven't eaten much at all. Linda, a 71-year-old from Florida, thought she was developing food sensitivities, but her doctor explained that her loss of appetite was tied to her heart struggling to move blood effectively. The National Heart, Lung, and Blood Institute notes that abdominal swelling and poor appetite are surprisingly common in early heart failure, and the danger is more than discomfort. If you're not eating enough, your body weakens further, creating a vicious cycle. One simple step is to track your meals. Notice if your waistband feels tighter at night or if you lose interest in foods you once enjoyed. These details can reveal more than you think. But remember, protecting your nutrition means protecting your strength. And while a bloated stomach may surprise you at mealtime, the next signal often keeps people awake at night: a dry, nagging cough or wheeze that refuses to go away, especially when lying down. If a bloated stomach can take away your appetite, a nagging cough can steal your sleep. Have you ever gone to bed only to be kept awake by a dry, stubborn cough that just won't quit, or noticed a wheezing sound in your chest that feels almost like asthma, but inhalers don't bring relief? For many people, this is one of the body's earliest nighttime warnings that the heart is under strain. Here's the science. When the heart can't pump strongly, fluid begins to back up into the lungs. That fluid irritates the airways, making it harder to breathe, especially when lying flat. Michael, a 73-year-old retiree, thought his cough was due to allergies. But when it grew worse at night and wouldn't respond to medicine, his doctor explained it was actually a symptom of early heart failure. Research published in the American Journal of Respiratory and Critical Care Medicine confirms that a persistent nighttime cough or wheeze is often linked to fluid overload and reduced heart function. A practical step is to notice when it happens. Does it get worse the moment you lie down? Do you sleep better with your head elevated? These clues can help doctors uncover the root cause. But remember, while propping yourself up with pillows may bring short-term relief, it only masks the problem. The real solution is getting your heart evaluated and supported early. And if a cough can disturb your nights, the next warning sign shows up in the most unexpected moments, when you simply bend forward to tie your shoes, only to find yourself suddenly out of breath. If a cough can rob you of sleep, Bendopnea can take your breath away in the most ordinary moments. Have you ever leaned forward to tie your shoes or pick something up, only to feel short of breath within seconds? Many people assume they're just out of shape, but doctors have a name for this Bendopnea, and it's a direct signal that the heart is struggling under pressure. Here's what's happening. When you bend forward, blood shifts toward the chest. A healthy heart adjusts without issue. But if your heart is already weak, that extra load makes it harder to move blood through the lungs, leaving you gasping for air. Patricia, a 68-year-old grandmother, first noticed it while gardening. Every time she bent to pull weeds, she felt her chest tighten. What she thought was just fatigue turned out to be an early marker of heart failure. A study in the Journal of the American College of Cardiology revealed that many patients with heart failure reported Bendopnea within 30 seconds of leaning forward. That makes it a surprisingly reliable early clue. If you notice breathlessness while tying your shoes, reaching into a low cabinet, or bending in the yard, don't ignore it. Write down how quickly it comes on and how long it takes to ease once you sit upright. This information can be crucial for your doctor. But remember, as unsettling as Bendopnea may be, there's still another signal that can be even more draining. It doesn't strike with sudden force, but with a constant weight, a deep, lingering fatigue that no amount of rest can shake. If Bendopnea can leave you breathless in an instant, persistent fatigue can slowly drain the life out of your days. Do you ever wake up after a full night's sleep only to feel like you never rested at all? Or notice yourself running out of energy halfway through chores that once felt effortless? This isn't ordinary tiredness. It's the body's way of saying, the heart isn't pumping enough oxygen-rich blood to fuel your muscles and organs. George, a 75-year-old Navy veteran, used to carry groceries up the stairs without a second thought. But over time, even folding laundry left him winded, and walking to the mailbox felt like a marathon. He thought it was just aging until tests revealed his heart was too weak to keep up with his body's demands. Studies in circulation confirm that reduced exercise tolerance and lingering fatigue are among the most common and disabling early signs of heart failure. Unlike normal tiredness, this exhaustion doesn't fade with naps or extra sleep. It lingers, making daily life harder and stealing independence step by step. The key is to listen early. If you notice yourself slowing down, needing more breaks, or feeling drained after the simplest tasks, don't dismiss it as just getting older. Share those changes with your doctor. Protecting your energy means protecting your future. But knowing these 13 early warnings is only half the story. What truly matters is what you do with them. And in the conclusion, we'll show you how listening to your body today can rewrite the future of your heart tomorrow. So now you've seen how heart failure rarely begins with a dramatic collapse. Instead, it often starts quietly with whispers, a racing pulse, swollen ankles, restless nights, or fatigue that never seems to end. And here's the truth: catching these signs early can make all the difference. With the right care, small lifestyle changes, and regular checkups, many people go on to live full, independent lives. That's why I want to encourage you: don't ignore what your body is trying to tell you. Pay attention to the small details, write them down, and share them with your doctor. Sometimes those little notes can prevent a big emergency. If this video helped you, save it so you can come back anytime and share it with someone you care about. And don't forget to subscribe to this channel, where we'll keep bringing you clear, trustworthy guidance on protecting your heart health and overall well-being. Remember, your heart has carried you through every moment of your life. It deserves your attention, your care, and your respect. By listening early and acting wisely, you're not just protecting an organ, you're protecting your future, your independence, and the moments yet to come.